Welcome everybody to everyone in Bridging Sectors to Tackle COVID-19. My name is Beth Rabbit. I am the Chief Executive Officer of the Learning Accelerator, a national nonprofit, and I'm joined today by three of my colleagues in the work. Eric Tucker, the co-founder and executive director of Brooklyn Laboratory Charter Schools, Tricia Forrest, partner and project manager at Urban Projects Collaborative, and Asaf Bitan, the executive director of Ariadne Labs. We're here today because our organizations, through different pathways, decided to tackle the challenge of school reopening and COVID-19 management in schools through partnership, explicitly cross-sector partnership. Our organization, the Learning Accelerator, works with schools across the nation and was really focused on how to accelerate the understanding and adoption of safety practices in schools as schools were thinking about reopening. In confronting that challenge, we knew that as an education organization, we actually didn't have all of the expertise we needed to do that work. And so we were lucky enough to actually get to partner with Asaf's organization, Ariadne Labs, which is a global healthcare or innovation organization, to help us really think at the nexus of education health to begin tackling practices. I'd like to hand it over to Eric to discuss origins of equity by design.
When school doors closed in New York City in March, we both struggled to figure out how to provide meaningful options and quality instruction in a newly remote context, but also began working to think through how to protect the health and well-being of our scholars, our families, our faculty members, our staff, as we prepared for the eventuality of reopening. And while it was unclear when reopening would come, it was critical for us to kind of reach out to experts, to develop plans and to prepare in a way that honored the challenges and the concerns and the fears that our families, that our faculty members, that our scholars had in this moment.
Some of our objectives for today's session would be that attendees will learn how the education sector partnered with other sectors, in this instance, design, engineering, medical professionals, to come up with innovative solutions to the challenges caused by COVID-19. Attendees will also learn how these partnerships can continue to support education in other sectors after the pandemic, and will hopefully learn about the successes of our partnerships and the challenges that arose in working across different sectors.
So both of the partnerships that we're going to talk about today shared some core underlying beliefs. The first was really around a shared commitment to the health and safety of students, educators, communities, and families that are served by schools. The second sort of core area that we all shared, whether we're in the formal education space or not, is that every student, every scholar in the US should have the opportunity to receive a high quality education during and beyond the pandemic, that we shouldn't let this be a time in which education lays fallow because of the health challenges that are in our midst. And so what both projects work on is really how to best create, with pragmatic tools and offerings, safe in-person learning options and environments as quickly as possible and as effectively as possible, not delaying that out toward many months or even years. We believe that offering evidence-based guidance to assist schools and communities and states on how to safely reopen, and that we really key on this idea that in-person learning can and often should be done, especially when critical mitigation measures such as masking, distancing, proper ventilation, and other things we'll talk about today are present.
Like so many other school communities and partners to schools, we recognized the significant disparities that the pandemic was having on those who were most vulnerable. And we struggled to identify evidence-based practices to inform our preparation for the return to school. we're heartened to be in a moment where there seems to be expanded and accelerated resources to relieve some of the pressure on schools on the horizon, and where hopefully some of the best practices are codified, shareable, and discoverable.
So where are we? We are recording this session on January 29th, 2021, not really knowing what might happen between the time we record and where we'll be when you're watching it. But suffice it to say, it's worth taking stock and saying, how are we doing? I'm a parent of 2 elementary age kids, as are several of the other panelists today. I'm also working with educators on a day-to-day basis, both locally and nationally. And I gotta say, we're pretty far from where we want to be as it relates to providing equitable access to really high quality in-person learning experiences. Recent estimates from a survey done, published in Education Next by Marty West and others, found that nearly half of the students in American schools are still in remote instruction solely. So not hybrid learning, no partial days, just at home. And we've done some great work nationally to improve remote instructional models. But what we see when we dig into the data is that it is our lower income students, it's our minoritized students who are least likely to have access to in-person school right now. In addition, the ability to access school doesn't seem to be actually related to community rates of the virus. In fact, it is more popular to be able to go to school in places that have had higher risk. And so we as a country really have a lot of work to do to understand risk, to respond to the reality of where we are, and put in place really practical measures that will be tools for getting us to and through. The last thing I'll say is there is a great number of students who have been completely disconnected from education. Bellwether Education says likely well over 3 million who have had no in-person or remote instruction since last March. That is part of what drives the 4 of us, our organizations, and I'm sure all of you, to thinking about how to change this dynamic and how to ensure that we get reconnected to highest possible quality of learning experience.
We know that vaccination is a really important step in promoting the safety and ability of schools to resume in-person learning at an even greater level. We also know that as essential workers, that vaccinating teachers is going to be a major ask in this near term. They also really help us in the progress toward herd immunity, that rate between 70 and 85% of people who we all need to reach in order to get past the COVID-19 pandemic. Now, even with vaccines in place, it's still important to know that other safety and mitigation measures like masks and social distancing and ventilation are going to be critical, at least for the next 9 or 12 months. That doesn't mean that everything will continue to be in the future as it is today, but it is important to anticipate and level set that some level of masking and distancing and certainly ventilation will be necessary to be in place. We await data on the safety and efficacy of the vaccines in children, and when vaccine campaigns may and will start amongst school-age children.
Many of those who we know and love mistrust the COVID-19 vaccine due to an accurate assessment of the history of discriminatory medical treatment and research. That apprehension regarding the vaccine, that hesitancy, is an understandable response to the lived experience of systemic racism.
We believe that schools can and must step into their role as educators of the population as it applies to the vaccine and knowledge and acceptance. And so move the conversation around vaccine hesitancy forward. Public schools are uniquely positioned to help ensure that their local communities have the information and confidence that they need to get vaccinated. And we can work to address vaccine hesitancy in a manner that elevates trusted local voices and promotes uptake of faculty, staff, students, and families.
Quick overview of what the Parabola Project was. This was really an opportunity to bring together education leaders and really to offer educational leaders a combined perspective from both education and public health in order to develop actionable, practical tools, guidance, strategies to minimize risks of COVID-19 while maximize learning. Risks can never be mitigated to 100% degree. We wanted to build in those public health perspectives that allow risks to be minimized to the greatest extent possible. One of the hallmarks of this work has really been to try to frame for educational leaders, for superintendents, for school facility leaders, principals, for parents, for communities, really a sense of what we call a balanced view of risk. And that view really aims to hold true to the evidence of what COVID-19 can and may impact educators, staff, and faculty, as well as children. And we've worked really hard to keep an updated tally of this fast changing landscape of information. But that information on the COVID-19 risk also is balanced by information, or it's integrated by information around the risks of losing in-person learning. And it's not a one-to-one perfect scale balance, but it's a way of offering a useful bridge into a conversation within and amongst schools and communities around what are the quantified risks. And so we really tried to integrate and frame these risks, not with an answer, but really with a broader set of frames so that schools, communities, and their stakeholders could make good choices about in-person learning. And that got us to a set of 9 parsimonious integrated principles that we felt the evidence from the health field, initially derived from our experience in hospitals and clinics taking care of the initial surges of hundreds of thousands and then millions of patients with COVID-19, and how we learned in the healthcare field how to protect ourselves as healthcare workers, how to protect other patients, their families, and how to keep functioning in the midst of dysfunction. And really, what we tried to bring these principles over into education and said, you are a critical, essential part of society, an essential system with which our kids need to function. And if we are to function, and if we are to maintain in-person intersections and interactions, which are so critical, this would be the way. These are the 9 things that you as a school leader, you as a school community would want to delve into.
So working together, the TLA and Ariadne teams actually spent the summer developing a readiness guide based on these principles that's really designed to help people take them from theory to action in their own context, their own school, their own district. We also knew that readiness guidance, if kept at the theoretical level without actual tools to help educators like you put it into practice, was not as helpful. So we developed a lot of tools for allowing folks to translate them to their own setting. And then through the course of the fall, we worked alongside a set of schools, primarily in Massachusetts, but also nationally, to figure out, hey, what does this actually look like in practice? You can see some of the tools that we've created. Different people are going to find different tools useful, but we also created a set of tools that are focused on, okay, if you're putting these principles into place, how are we also going to do the work of teaching and learning, given the constraints that might be present? All of these tools are meant to be super easy to use. Here's an example of one of the most popular, which is about classroom preparation and cleaning. We also did storytelling because we know that part of the nature of the challenge educators face is just being able to see the work in action and understanding, what are people learning? What are people doing? As we close out this first phase of work with the Parabola Project, we're starting to look ahead. So many of the resources and the principles that we've created are absolutely applicable to the current environment. We're also interested in looking nationally and understanding how districts are experiencing this. How are they putting this into practice? And how do we build a bigger tent of organizations, ranging from policy and advocacy organizations, additional health and research organizations, and folks like the team at Brooklyn Lab who are on the ground doing this work. If you are a district who wants to learn more, let us know. We've also learned that the context, the political will, the nature of what a community is feeling about reopening or not can in fact also be really important accelerating or decelerating factors. So we're going to be thinking about those issues as we head forward. I'll turn it over to the Equity by Design team.
Brooklyn Lab, in partnership with organizations like Urban Projects Collaborative and Innovate EDU, has over the years pioneered an approach to using human-centered design methods and processes to inform school practices and systems. This past spring, when school doors closed, we asked how to ensure our school community's health, safety, and thriving. We reached out to businesses like UPC, design firms, nonprofits, universities, and experts to inform our work, to hear from and channel the fears and insights of our families, students, faculty members, and administrators to prepare for an equitable reopening.
We started this process with a mandate to ourselves and to all the design firms that the solutions that we were proposing had to be applicable to all students, practical and easy to adapt, should we end up having or being in a position where other districts could benefit from this, and universal for use by all others. And we tied the concept of what we wanted to do in the first place and of having our students and our learners feeling seen and heard and safe by having them and our staff involved in the design process. We undertook a design charrette with 5 design houses that had multiple sessions with our teachers and students, where we got an idea of programming, got an idea of concerns, where people needed to feel heard and seen and have needs addressed. And from those sessions and from that initial collaboration came up with several solutions that was initially put together in a back to school facilities toolkit. And then from that toolkit, identifying just immediate projects that we could undertake that would go a long way towards having the school, the facilities make the real modifications necessary for a safe operation.
From facility safety planning and instructional scheduling development for students with individualized education plans, from success coaching training modules to communication resources, Equity by Design has worked with experts, school administrators, teachers, parents, and even students to produce resources that support learning in ways that all members of a school community can benefit from.
In addition to the behavioral changes that we had to ensure took place, we also recognized the need for modifications to the space beyond just classroom layouts and markers. Knowing and understanding from the science that we relied heavily on, that air quality was something that we had to pay attention to. We worked extensively with the school's MEP engineer to conduct an audit of our existing system and figuring out how to maximize the air exchange rate. And again, this was just another example of how working with the architect and the design industry was critical for the school, because schools operating by themselves are not focused on the facilities component. And being able to utilize this resource was critical in ensuring that we were not only listening to the science, but we're also making the changes necessary for our staff, our school community, our families to feel safe.
From rethinking arrival routines and procedures to accommodate social distancing and symptoms checks, and redesigning pedestrian flow around the building, to establishing contact tracing ecosystems so that schedules for the day anticipate the eventuality that a staff member or a student will test positive. We have resources on equitybydesign.org to help schools in containing the spread.
We realized early on that we couldn't have a one-size-fits-all approach to our classroom configuration because it would not work for the educational style we use at lab. And so we explored different configurations for different types of instruction, including some for classes that required additional service providers. we worked with our design teams to reconfigure layouts based on different requirements throughout the course of the day. And it is something that we continue to do as we look into how we provide instruction and what works and what doesn't work, just continuing to be flexible in our approach, but also being guided by the science.
So we just shared a lot about the resources that came from these two unique partnerships, school and design teams, a health organization and education intermediary. Equally important as these whats is a bit about like the learning of the how to work together. So we want to take a moment to just reflect on a couple of things that we learned. So Eric, do you have a thought about a lesson for others if they decide to pursue working cross industry and sector?
Whether we're talking about IT or architecture, procurement, it's important to recognize that we're all going through this pandemic together, and that oftentimes the prospective partner on the other end of the phone or the Zoom call is also the child of a medically fragile parent or the parent of a student who desperately needs school to reopen in person. Understanding the why that your partner comes to the conversation around supporting your school community with is critical to working effectively.
Trisha, what about you?
I think my key takeaway from this, and it was something that we tried to impress upon everyone we worked with, was that our mandate has always been that we are in service to the most vulnerable among us, and that every decision we make, every potential solution has to serve that population, because if it does, then the potential for it being of value to the rest of the population is greater. And so it's to never lose sight of the most vulnerable among us when we are enacting solutions, and to understand the importance that culture plays in how solutions and conversations need to be had.
Asaf?
Well, building on what Trisha said, because it's so aligned with our experience as well, in order to serve communities that are most vulnerable, to reduce suffering, whether it be health or learning loss, I think what I've learned and reflected a lot on is that you cannot approach a complex topic such as in-person safe learning without the dependency to work together across disciplines. It's not just a nice theoretical good to have thing. I literally could not imagine serving communities and of our learners and teachers if we had only brought a health perspective. We needed the perspective of educators, parents, educational innovators like our partners, and so many others to inform the work. Approaching it from only one field is just too necessarily limited. You have to learn how to edit and how to get to the core nugget so that you can transfer that core insight and learning across fields, make sense of it through their magnified worldview, and then something amazing comes in that integration.
I oftentimes reflected on the real need for curiosity in these projects for when things do go awry or when things are misunderstood, because the expertise is there on both sides, and it's really important to bridge with curiosity to figure out how to get to that simpler, mutually understood purpose. And I think that gets to my point, which my other point, which is this work is really hard. We are all sprinting together and trying to learn as quickly as possible. I think doing so with purpose over perfection has been a really important part of the work together. And I've, for one, been incredibly thankful for the opportunities to do that with both Ariadne Labs and their team, but also, frankly, with integrations with Equity by Design work as well. With that, we're ending with a call to action. So please, at the parabolaproject.org site, at the equitybydesign.org site, We have tons of resources. Do not reinvent the wheel. Start with some of these evidence-based resources, connect us with other evidence-based resources, and please share them with those that you know are in the work. You can absolutely reach out to us. We are here. It is our purpose today, and you can do so at the addresses below.